Absolutely.
What's the peri and post-procedural management? How long do you need anticoagulation, et cetera? Raghu.
Great, thank you. Steady state anticoagulation, I think that's the key for keeping these patients well enough. So there's this paper that I've not seen much talked about. Michael, I've talked to you about this. This is from 2013. This is clot resolution in 3 weeks in the Einstein PE patients. So when you look at patients with who had steady state anticoagulation with the DOAC rivaroxaban 3 weeks, you see that only 12% of patients had no resolution of the clot. Everyone else had significant resolution of the clot. So we just heard about the Swiss cheesiness after you immediately remove the clot burden, right? So in 3 weeks, these people are recanalizing. So I think, I don't know why this is not picking up steam on that, but I would like to hear others' input on it. But anyway, so I wanted to show that first and then talk about the European heart and guidelines. And as you can see, the guidelines for intermediate or low-risk PE, initial parenteral treatment has a 1C recommendation, while low molecular weight heparin, fondaparinux, and combined with anticoagulation with warfarin gets 1A and 1B. And when you look at alternate management with rivaroxaban or apixaban, they again get 1B recommendations for PE that are not in shock. And they have a caveat for the dabigatran and edoxaban that you need to have an initial parenteral lead-in. So choices, right? Like Michael said, we have lots of choices, but a lot of confusion too. So again, earlier this year, there was a good guidance paper for DVT and PE that was published by this group here, which tried to make it simpler for us. What they do is 5 to 10 days of anticoagulation leading into it, and then short term for situational DVT, which generally is 3 months now, not beyond 3 months anymore, and beyond 3 months, consider long-term anticoagulation, which I'll show how it should be done. And for dabigatran and edoxaban, they say that you need to have the initial heparin lead-in. So while the patients are getting treatment, like Michael here said, that it is important periprocedurally also to maintain adequate anticoagulation. The PTT and anti-10A values, again, are not discussed that much. While we were training in Cleveland Clinic, that was a big deal, that every patient, we needed to make sure that their anti-10As would match, because of this relatively new trial. Pharmacists published this, 2,000 plus patients. And when they looked at the PTT versus anti-10A, there was tremendous scatter with that heparin. And what that turned out to is that discordant pattern led to poor clinical outcomes, both increased 30-day mortality and 21-day major bleeds. So anti-10A should be used in these patients, in my mind anyway, who are submassive PEs, if you have them on heparin. Think about that when patients have heparin resistance, high dose requirements, which may mean antithrombin deficiency or factor VIII activity elevations in obese patients, in pregnant and critically ill, and patients who have antiphospholipid antibody syndrome with baseline prolonged PTT. So what is the DOAC of choice and what is the dose in patients after lysis? Well, other than some edoxaban patients, all of these patients were excluded, so we really don't know. Some people say there's no need to do the BID dose for Xarelto. Some people say that you need to, and it's all over the place. Anyway, so 4 to 6 weeks follow-up, we generally do in the outpatient clinic with an echocardiogram, 3 months, and then assess the anticoagulation duration at 3 months. So how do we assess the duration? So there are multiple different score systems. I'm not going to go through this. You can pull these up. There are calculators for this. HER2, Vienna risk, and DASH. DASH is the most commonly used risk, where if you have more than one point, then you're potentially high risk for for recurrence. So here is one proposed just by me. This is my practice. First VTE, if it's situational, after orthopedic surgery or what have you, just 3 months of anticoagulation and stop it. And if it's malignancy, low molecular weight heparin,